In today's video, we are going to demonstrate how to properly fit a K4 CPM for a knee and a hip.
The first step is to adjust the hip access pivot point to the side of the injured extremity. To do so, we will loosen the knob, pinch the top and the bottom, twist to the left, and remove that from the CPM. We will then pinch the two knobs located towards the bottom and pull that out as well. We will then go to the side of the injured extremity. We will pinch the two knobs at the bottom and reinsert that. It'll lock in place. We will then insert the top portion. We want that locking mechanism to be facing towards the left. Once we insert it, pinching the top and the bottom again, we twist it towards the right. That will lock it in place. The next step is to place the CPM on a couch or a bed. We prefer to place it on a bed because the surface is more level. Once we have placed the CPM on a couch or a bed, we are then going to plug the unit in, connect our controller by twisting. We lock that in place and then turn the CPM on. Now the patient can turn the CPM on and off without messing up any of the settings on their controller. The switch is just located towards the base of the CPM. The next step is to adjust the knobs for ankle adjustment of foot inclination. We want to make sure that the foot plate is at a 45-degree angle. To adjust, you will loosen the knobs on either side. You will then push or pull the foot plate until it is at a visual 45-degree angle. To lock that in place, you'll once again twist the knobs on either side. Once we have adjusted the foot plate, we want to go ahead and loosen the knob for length adjustment of lower leg. Once again, there is a knob on either side. We will loosen to allow that to slide freely. Once we have made our adjustments to the foot plate and the lower leg adjustment, we are going to adjust the knob for the femur length adjustment. We want to, once again, twist to the left to loosen, pinch on the top and bottom to adjust, and slide it so that it is at the top of the thigh support bar. Once we have adjusted the knob for femur length adjustment so that it is at the top of the thigh support bar, we want to make sure that our controller settings are set to the doctor's protocol or a generic protocol based on the type of surgery the patient is having. To adjust these settings, we'll press the menu button, the extension button, plus or minus to adjust accordingly. We want it currently at 0. We'll then press the flexion button, once again plus or minus to adjust it, however we want it at 60. Once we've made the adjustments, we'll then press start, and we want to run the current carriage angle to 30 degrees. Once it has reached 30 degrees, we'll go ahead and press the stop button to begin the fitting process. To begin the fitting process, we'll have the patient recline comfortably. We will feel for the patient's greater trochanter. We'll then align the hip access pivot point so that it aligns with the patient's greater trochanter. To do so, you may have to adjust the height of the hip access pivot point. To adjust this, you pull up and slide, and lock it into place. Once we have aligned the patient's greater trochanter with the hip access pivot point, the next step is to align their joint line with the knee pivot point. To do so, we will loosen the knob for the femur length adjustment, pinch on top and bottom, slide that knob down the thigh support bar until the patient's joint line has aligned with the knee pivot point, we will then tighten that knob. As we adjust the knob for the femur length adjustment, the lower leg adjustment will adjust automatically. Now, to ensure that the patient is properly fit, we will want to reach our hand and feel to make sure their heel is pressed up against the foot plate. Once we have positioned the lower leg adjustment in the proper location, we'll twist the knobs on either side to tighten that in place. Once we have completed the adjustment to the lower leg, we'll then adjust the foot plate to the patient's comfort. Now, it is very important that we don't go too far from that initial 45-degree angle. Once we have adjusted the foot plate for the patient's comfort, we tighten the knob on either side. Once we have made all of our adjustments to the CPM, the next step is to run the current carriage angle, which is the number displayed in the middle box, to 30 degrees. The reason that we do this is to ensure that everything is aligned properly. Once we confirm that the greater trochanter is aligned with the hip access pivot point, the knee joint line is aligned with the knee pivot point, and the patient's heel is pressed firmly against the foot plate, we'll then go and secure all the knobs to make sure everything is nice and tight.